Cecilia Sen and Christophe Spency regarding the CSM as a replacement of MRI. Please, you have 15 minutes to explain us the difference and maybe the choice.
Yes, thank you. Yes, my name is Cila Tsene. It's a pleasure to be here. Thank you for having me here. And I'm from GE Healthcare. I'm not about to present my product of Pristina mammography, but I'm going to talk about the contrast enhanced spectral mammography comparing to MRI. And I'm trying to answer to a question that is it a possible replacement to MRI or not? We have a great story of mammography and contrast enhanced spectral mammography. We launched our first system in 1999 of the GE digital mammography. And as Christopher Columbus, when he started, he left Europe and he went for an explorer. He didn't expect it to find America. He was expecting to have something less, but he found out something huge. And this is how we launched just 10 years after the digital mammography, our first contrast-enhanced mammography, which is a bigger success as we expected because we were the first one to use this technology, and we just launched for radiologists to see how good is it. And just after 2009, we can say that we are above 120 publications and 450 installations worldwide. Big experience, we can say. And 8 years after the first generation, we introduced the second generation of the contrast, which is a new algorithm, a new Bucky grid, many improvements since we launched the first generation. What we can say that in diagnosis, we have mammography limitations of the overlapping tissues. We know that we have dense breast and fatty, so we can say that as the ABCD from fatty to dense, it's hard to find lesions and things that we are looking for. So we say that 48% of the sensitivity of the dense breast, and in overall the all BROD scale, 78% of sensitivity. So this is the mammography limitations in diagnosis. What we need is to see and go further for complementary techniques, which is the ultrasound and MRI for the full diagnosis, but it has its own limitations as well, as MRI has the limited availability, for sure in Eastern Europe countries. I will tell some stories. The long waiting lines, costs, the exam time, and so on. I will mention them. And of course, this is the MRI limitations. So the aim is to compare these two techniques. And what I can say that for the breast MRI, I just, coming directly from Paris, I had a great story with a local radiologist who has a private clinic, and he has a fully equipped clinic. And I was asking him what is his opinion about contrast-enhanced mammography. And then he said that it's great, it's awesome, but I'm not using it because I have 3 MRIs. And because of his in clinic, it's a fully equipped clinic, it's a private, no waiting list. And he mentioned, of course, that no reimbursement on contrast-enhanced mammography, so he prefers to choose MRI. But what if we have, for example, a Romanian country, where I have a story there, the radiologist had an exam of her niece and in the public practice. And she was taking the first image as a conventional 2D image. But she was not confident to say that everything is okay. So she went for the tomosynthesis. Again, after the tomosynthesis, she was not confident 100% that, let's say, everything is okay, you can go home. And she decided to took her to her private clinic where she had the availability of contrast-enhanced mammography. And after that image, the story ended up with mastectomy. And this is only, she decided to took her in her private clinic because she had the possibility and because it was her niece. And I was asking her that what would you do differently? I mean, in the case that if you don't have the accessibility of contrast-enhanced mammography. And she said that I would have stopped the diagnosis in the hospital without the real diagnosis. So no cancer, no mastectomy. Let's see each other in 2 years or whatever. So the availability to have this contrast-enhanced mammography saved her niece's life. And this is huge because in a country in Romania or Eastern Europe, where we don't have that accessibility to MRI, regions, costs, and everything, but we have easier accessibility to contrast.
For most women, mammography is a word that resonates with anxiety. For radiologists, it can mean uncertain diagnosis, especially in the case of dense breasts. Uncertain diagnosis usually call for additional imaging, and you would refer your patient for a breast MRI, knowing its limitations. What if you had an alternative that could help you give your patients a quick and confident diagnosis? GE Healthcare introduced the contrast-enhanced spectral mammography exam. With Cenobrite, you can give your patients a confident diagnosis the same day, in the same place, in less than 7 minutes after the inconclusive mammogram. 7 minutes for a diagnostic imaging exam that brings high sensitivity and high specificity. Cenobrite helps you to reduce false positives and helps prevent unnecessary biopsies and surgeries. Cenobrite offers you a way to get a confident diagnosis for your patients faster. It's all about what you'll do for your patient's health. Cenobrite. GE.
So how does it work? Actually, in the previous presentation, we got a nice insight how contrast it works. All that we need and we're interested of is the blood flow and of the neovascularization and the angiogenesis. But it's interested of that with these new vessels, we want to see that how much of the contrast leaks into it and trapped it for a certain time. And then we use the iodine contrast in digital mammography to enable this visualization of the contrast uptake. For simple steps, we welcome the patient in the room. What is really good that it's the same room and the same mammogram, very comfortable. Then we have the injection of the contrast agent and acquisition, the normal acquisition, and then the review, which is intermediate and fast. What we can say that within 7 minutes, we can have the image. After 2 minutes after the injection, we perform the low and the high energies of each views of both breasts. Then we have the low energy image, which is according to some of the studies, it's identical, or it's the same image quality as the standard mammogram. And then we have the recombined with high energy. We don't have high energy image because the high energy image is just a huge white of nothing. So we have the low and the recombined. It's not a subtraction, it's a dual energy image. Then, from 2009, all these publications, we can read many of the opinions of the radiologists, and there are two comparisons. We checked what is the difference between standard mammography and contrast-enhanced spectral mammography. And then quickly we can say that we have better diagnosis, improved image with the CSM. Let's say that as a conclusion, we know that with contrast-enhanced mammography, it's a higher diagnosis than with the mammography. But what is the most important to check, the most interested of we need is the CSM vs MRI. And what studies shows of this, that comparing the CSM and an MRI, that significantly shorter exam, of course, of the contrast enhanced mammography, and the measurements, the size measurements, the tumor size measurements, says that the CSM is a good match, and so the additional measurement using the breast MRI did not improve the quality of the tumor size measurement. And what is the results? That in sensitivity, there is no much difference between these two technologies, but we can say that we have a slightly higher specificity in CSM. And what we can have that from last year's of USAB publication, Professor Sardanelli wrote a nice article of the comparison of these two technologies. And as a summary, I show you these 10 points that he emphasized. As a first step, let's say that breast MRI is still a 3D image, while CSM is 2D, even if it's two different images, but it's not a 3D. So of course, MRI offers dynamic information, while CSM does not. MRI has additional information as the T2 weighted image or the diffusion weighted images. CSM does not have such information. MRI is radiation-free. However, it's worth to mention that contrast-enhanced mammography is still less than the standard of 3 milligray, and CSM is less than the magnification view. MRI has contraindications such as the claustrophobia and due to the magnetic field and the radio frequency pulses, and CSM does not. It says the article that it has the CSM has limitations to it has image artifacts in case of implants. CSM is, we can say that commercially more available, so the accessibility to its technology is easier than to the breast MRI. The examination time, if we check that CSM can perform, let's say, a shorter time than the full protocol of the MRI. Okay. Patient acceptance for CSM is reported higher, and the difference between the contrast agent, we can say that the gadolinium-based contrast agents have a rate of acute adverse reaction lower than the iodine, and the cost of the CSM is less than the MRI. So as quickly what to do in case of when we have contraindications to breast MRI, we do a CSM. Patients with implants, we can do both. If we have a high-risk screening, we go for MRI because of the dose. Intermediate risk, we can do with CSM. Preoperative staging, check with both. Monitoring the neoadjuvant therapy, we can check with both. Search for acute primary breast cancer, both. And the unresolved doubts of tomosynthesis or ultrasound, both techniques are well accepted. Then we have the prognostic breast cancer imaging, we do with MR. If we have contraindications to gadolinium, we go to CSM. If we have contraindications to iodine, we go to MRI. And I hope I answered to the question that is it a possible replacement to MRI? It is not. It's just a proven and fast, precise alternative. Thank you.
Okay, thank you very much. Any question from the floor? Well, I have only one for you about regarding the case that you report about mastectomy after the second look after the CCM. I think that a point important between the difference in the versus MRI with DCM is also for us surgeons is the high rate of false positive in MRI for multicentricity and the high level of mastectomy because we have different lesions that we can see with the MRI. Something that is better with the CSM because we can increase the oncoplastic surgery and to decrease the risk and the rate of mastectomy with the CSM.
Absolutely right.
Okay.